Imagine a cough that lasts for weeks, even months, not only robbing you of sleep but also the ability to breathe. A cough so intense it can send young children to the hospital and cause serious, even fatal complications. This isn't just any cough, it's pertussis, also known as whooping cough. Stay tuned until the end of the video to learn about the symptoms of this deceptive disease. Hello, if you're new here, don't forget to subscribe and enable notifications so you don't miss any important content. Today, we're discussing an old but still unfamiliar disease, pertussis, or whooping cough. Despite seeming like a disease of the past, it's making a comeback and remains a real threat. Do you know how to protect your family and why pertussis still poses a danger? Stick with us to discover the early symptoms of this disease, its consequences, and how we can effectively combat it. Pertussis is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. Despite the availability of vaccines, it still poses a risk, especially to infants and unvaccinated individuals. Pertussis starts with symptoms similar to those of a common cold but can progress to intense and prolonged coughing fits. These convulsive coughs can last for weeks or even months, making the disease debilitating and, in severe cases, potentially fatal. History and epidemiology. Pertussis was a major cause of infant mortality before the development of vaccines in the 20th century. Mass vaccination led to a drastic reduction in cases. However, in many parts of the world, especially where vaccination coverage is low or population immunity has weakened, pertussis remains a significant problem. In recent years, there has been a resurgence of the disease, even in developed countries, due to declining vaccine immunity over time and vaccine hesitancy. This resurgence underscores the ongoing need for surveillance and vaccination to prevent outbreaks. Symptoms of pertussis. 1. Runny nose. Runny nose is the first symptom of pertussis, presenting as a constantly dripping nose with clear, watery nasal discharge. Similar to a common cold, this symptom is often overlooked but marks the beginning of the catarrhal phase of the disease. During this period, which can last 1 to 2 weeks, the infection is highly contagious, facilitating the spread of Bordetella pertussis bacteria. Although runny nose may seem harmless, its persistence without other evident causes should raise suspicions of pertussis, especially in outbreak contexts or in unvaccinated individuals. Early detection can aid in prompt intervention and transmission containment. 2. Low-grade fever. Low-grade fever is an early symptom of pertussis that often goes unnoticed due to its similarity to common colds. Characterized by a mild elevation in body temperature, usually not exceeding 38 degrees Celsius (100.4 degrees Fahrenheit), low-grade fever occurs during the catarrhal phase of the disease. This symptom, accompanied by runny nose and mild cough, marks the onset of infection and can last for 1 to 2 weeks. Low-grade fever, although subtle, indicates the body's response to bacterial infection and is a sign that pertussis may be present, especially in susceptible populations or areas with active outbreaks. Detecting it aids in early diagnosis and reduction of spread. 3. Mild cough. Mild cough is an initial symptom of pertussis, present in the catarrhal phase of the infection. Initially, this cough may seem harmless and is often mistaken for the cough of a common cold or allergy. It is intermittent and not very intense, usually lasting 1 to 2 weeks. During this phase, the cough does not yet have the convulsive characteristics of the later phase, making pertussis difficult to identify. However, its persistence, especially in combination with other symptoms like runny nose and low-grade fever, may raise suspicions and lead to early diagnosis. Recognizing this mild cough is crucial to prevent progression to more severe stages of the disease. 4. Whooping cough. Whooping cough is the most characteristic and severe symptom of pertussis, appearing in the paroxysmal phase. This cough is intense and occurs in rapid, repeated bouts that often end with a high-pitched inspiratory whoop sound. Each bout can last minutes, being so exhausting that it causes shortness of breath and can induce vomiting. Whooping cough can persist for weeks, causing physical exhaustion and respiratory complications, especially in children and infants. Identifying this symptom is crucial for diagnosis, as it distinguishes pertussis from other respiratory infections and requires immediate medical intervention to reduce severity and spread of the disease. 5. Vomiting after coughing. Vomiting after coughing bouts is a distinctive symptom of the paroxysmal phase of pertussis. It results from intense and prolonged spasms that cause a child or adult to cough so vigorously that it triggers the vomiting reflex. This occurs due to strong abdominal pressure and throat irritation during coughing bouts. This symptom is particularly common in young children and can contribute to dehydration and weight loss, further complicating the clinical picture. Recognizing recurrent vomiting after coughing is essential to differentiate pertussis from other respiratory infections and initiate appropriate treatment to minimize symptom duration and severity. 6. Cyanosis. Cyanosis, a bluish discoloration of the skin and mucous membranes, is a severe symptom that can occur during the paroxysmal phase of pertussis. It results from lack of oxygen in the blood, caused by intense coughing bouts that impede breathing. This discoloration is most noticeable around the lips, fingertips, and around the eyes, indicating momentary respiratory insufficiency. Cyanosis in infants and young children is particularly concerning, as their respiratory systems are more vulnerable. The presence of this symptom demands immediate medical attention, as it can lead to severe complications such as seizures or neurological damage due to inadequate oxygenation. Recognizing cyanosis as a critical sign aids in rapid intervention and effective treatment of pertussis. 7. Extreme fatigue. Extreme fatigue is a common symptom in pertussis, especially during the paroxysmal phase of the disease. Intense, repetitive coughing bouts quickly deplete the body's energy, leading to severe and persistent tiredness. In young children and infants, this fatigue can be even more pronounced due to their lower energy reserves and difficulty recovering between coughing bouts. Extreme fatigue can interfere with sleep, appetite, and normal daily activities, significantly affecting the patient's quality of life. It is essential to identify and treat this symptom to support complete patient recovery and avoid additional complications resulting from prolonged exhaustion. 8. Feeding difficulties. During pertussis, especially in infants and young children, feeding difficulties are common due to intense coughing bouts. These convulsive coughing episodes can be so frequent and severe that they interfere with the patient's ability to eat normally. Violent coughing can cause discomfort when swallowing, leading to food refusal and weight loss. Additionally, shortness of breath during coughing bouts can further complicate feeding, as swallowing may be painful or difficult due to irritation of the respiratory tract. These feeding difficulties can worsen malnutrition and delay recovery, making medical and nutritional support essential during pertussis treatment. Recognizing pertussis symptoms, from mild to severe, is crucial for seeking early treatment and avoiding complications. If you or someone close exhibits these signs, especially in children, seek immediate medical guidance. Knowledge and awareness are our best defenses against this debilitating disease. Stay well until the next video.